Good evening, everybody.
Good evening, sister.
Good evening,
Good
sister.
evening, sister.
Sister.
Hello.
Hi.
Hi.
I hope everybody's doing well. Okay.
Very well.
Bad network. So today we are starting with our sexually transmitted infections. I hope you can all hear me.
Yes, sister.
Okay. All right. So we are starting with our STIs. So I'm sure we are all familiar with STIs. So who can just at least give us a brief description or just a definition of STI for us? Since we are all familiar with it. Who can just tell us something small about STIs? Anybody?
Yes, sister.
Hey, somebody has sent a message and then we are there. Okay. Can somebody just brief us something small about it?
Sexually transmitted infections, also known as the venereal disease, are disease conditions that are passed from one person to another through sexual intercourse, either oral or anal sexual intercourse.
Either oral, anal, or kindly continue for us.
It can be oral, it can be normal sex, it can be anal sex, then it can be that those are diseases that are transferred from one individual to another through sexual intercourse. Not only
Oh, that is
it's oral, that's what I mean.
okay. All right. Okay. Thank you very much. So, like sister said, sexual transmitted infection, that is STI, is also known as what? The sexual transmitted diseases. So STI and STDs means what? The same thing. And these are what? Venerable diseases that are passed from one person to another. That is sexual what? Contact. The infections, vaginal intercourse, oral sex, and what? Anal sex. Just like what sister what just shared with us. And there are so many types of what? STIs. So many types. So the first one we will talk about is chlamydia. So what is the tree name for chlamydia?
Odepua.
Chlamydia is Odepua. Hey.
Sister, it's not.
Please, do you agree with that? Babaso. What about gonorrhea?
Babaso is gono. Babaso is rather gonorrhea, not chlamydia.
One very wise.
One fairy wase. That is what I know. One fairy wase.
One the tree name for chlamydia.
Yes, sister. Is the tree name.
Please, do you agree? Do you agree with her?
Sister, we don't even know. We don't understand. We don't know.
You don't understand what she's saying.
We don't even know.
So how do you call those who don't know? How do you call it in your dialect? The Ashantis, can you help us? Address, are you there?
Sister, please, I'm here.
So Address the children for chlamydia.
You don't know. Sister, please, I don't know.
Hey, me too, I'm finding out. Me too, I don't know. That's why I'm asking you.
Sister, we don't know.
You see, I'm very well. And then we all know it's enemu yare, but they do have a special names for them in our local dialect. Is Dorcas also here? Dorcas. Is Dorcas here? Hey, August Rep, talk to us. Oh, so it seems we all don't know. So can't you go and find out? So chlamydia is a common sexual transmitted infection that can affect both men and women. And there's a bacterial infections. Kindly note the difference. Some are viral infections and others are bacterial. We should know what the difference is. But chlamydia is a bacterial infection. And it can affect several organs, which includes the penis, vagina, the cervix, and others. And it can cause serious permanent damage to a woman's reproductive system. And that is the most infectious cause of genital and eye and it's also the leading bacteria in STIs. So for instance, maybe MCQ, you'll be answering MCQ questions. There can be a question like which of the following is a leading bacteria STI, and you are supposed to know they are referring to chlamydia. This internet. So the causative organism is chlamydia trachomatis. It was the bacteria.
Sorry, sister, please, the slides are very small.
My sister, Zoom.
Is it okay? Is it okay now?
Yes, sister, thank you.
So the causative organism is bacterium chlamydia trachomatis. And chlamydia, we should also know chlamydia is often referred to as a silent infections, because most people with this infection, they don't experience symptoms, most of it. So sometimes also known as the silent infections. So we should take note.
Bacterium trachomatis.
So we have the mode of infection, that is, it's carried in semen, vaginal fluid, that is during unprotected but with an infected person. And the second one, it can be transmitted to the fetus, that is during pregnancy, or to the infant during delivery, that is causing eye infection. That is why these days the subsequent care of the newborn, we do care for the eye. So we give the prophylaxis, that is the chlorphenicol and the tetracycline. These are meant to prevent some of these infections. Then genital contact with an infected person, and those at risk for chlamydia. You have the unprotected vagina, anal or oral sex. and those with multiple sexual what? Partners. And sexually active young men at a higher what? Risk. Why are sexually active young people at a higher risk? Hi, why? Sexually active young people, why are they at higher risk? Can somebody help us?
Okay, sister, please let me try.
Okay.
Sister, please, with young men that are sexually active, most often, like, they go about having sex with so many people. And if any of those people that she is having sex with is infected, the chance of him getting it is also high. And besides, those who like doing that, there are people who indulge themselves in those acts like drinking alcohol and smoking. So they are most often they go with they have immunosuppression because of those things that they take, and they are prone to getting this infection easily. Thank you, sister.
Oh, thank you too. And there's a message and somebody saying they have a serial what partners. What do you mean by that? Serial partners. Yeah, please, the one who sent the message. What do you mean? Throw more light on that. So they are higher risks. The sexually young active, they are at higher risk because of what they have. They claim, they believe they have energy, and they chase after what? Sex. And this put them at a very, very, very higher risk. When we are young, I'm sure we were all curious. And if care is not taken, you keep on changing because you want to find out what is in this, what is in that, what is in this. Experimentation, what? Period. And this can what? Prone you, put you at a higher risk for what? STIs, not just chlamydia, but all what? The other what? STIs. And we have signs and symptoms. That is according to Smith Lowry, that is 2017. Most people with chlamydia do not exhibit what? Symptoms. That is why we call them infections. So we are moving on to the symptoms what? In women. With women, they include what? Abdominal pain, vaginal discharge, and there's bleeding between what? Period. There is fever, painful intercourse, and what? Bleeding after what? So that's examination to look out for what? The presence of what? Physical symptoms such as discharges.
Sister, please, your line is breaking. No, we can't hear.
Please, can you go over the signs and symptoms in men, because your line took you.
In fact, the internet is very, 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 very bad here. So swab sample from what? The penis, the cervix, and what? The urethra. Then also urine sample what? Analysis. Today, why? So all that we need to at least learn about how chlamydia is being what? Is being spread. So it means sex without what? Without a baby are the main what causes. And with chlamydia, some penetration that don't have to occur before what you contact. Sometimes even touching what? The genitals. Together may what? Transmit what? The bacteria. Or sometimes people feel that, oh, I just want to have romance. If the person is infected and there is touching of the genital, It can what? Also transmit what? The bacteria. So we should be extra what? Careful. Chlamydia is dangerous. So we have management. Because it's a bacterial what infection, it is easily what treated with what? Antibiotics. And treatment should be initiated as soon as what possible after what? Diagnosis. So I'm sure with nurses, we are midwife. With reassurance, we are best, but we are expert in that. So you have to reassure your client and explain what the conditions, what as soon as what it is being what at the same time to prevent what reinfections. So for instance, if a woman has been diagnosed with chlamydia, you need to know the number of partners that she is sleeping, he or she is what? So persons with chlamydia should abstain from sexual what? Activity. That is when it has been diagnosed and what treatment or medication prescribed to cure what? Chlamydia. It is very true. It is easily what treatable. Then antibiotic ointment is usually applied to what? Baby's eyes after birth to treat what? Untreated what? Chlamydia. That is why as midwife, now we work with the subsequent care, we have what? The eye care. We do administer what? Chloramphenicol and what? Tetracycline. And all these help what? To treat what? The baby's eye from what? Undetected what? Chlamydia. So the drug what regimen below are taken from the Centers of Disease what control. I'm sure with this one, they keep on revising it almost every year. So for non-pregnant adult, which is what's recommended, usually give azithromycin 1 gram orally in a single dose, or doxycycline orally twice a day for 7 days. So this drugs regimen is according to the Center for Disease Control is 2015. That is STI treatment guidelines. So for non-pregnant adult, which is recommended, there's a need to give I know midwife we are prescribers. Yes. So you have to prescribe those. Or the cycling 100 milligrams. Even this is the treatment. Aside that, I'm sure most facilities do have their protocols too. Then alternatively, chlamydia treatment regimen for non-pregnant adults. Serve the erythromycin base, that is 500 milligrams orally 4 times a day for 7 days. Or the erythromycin hallucinate 800 microgram orally 4 times a day for 7 days. And others also give the cloxacillin 300 milligrams orally these days. And this pregnant women. But they is advisable, it's recommended that you give azithromycin, that is 1 gram orally in a single dose. Or alternatively, they can be given amoxicillin, that's a 500 milligram oral TID for 7 days. Or the erythromycin. So it depends which one you go, and they are very strong antibiotics. And these help to clear the bacteria away from the system. So no, with a pregnant woman should not take doxycycline. So what is the side effect of doxycycline? What is the effect if a pregnant woman takes the dose? What are some of the effects? Who can help us? What happens when a pregnant woman takes in dose? Because it's contraindicated in pregnancy. Midwives.
There will be a teratogenic effect on the baby and the fetus, sorry.
And so it can
a teratogenic effects.
Is that Rebecca?
Sister, I'm here. It can also affect the tip of if the child is about to grow, so that it can also have effect on the dental of the fetus. That's the gum. And then skeletal, and then it also has effect on the baby skeletal function.
Yeah.
Because in utero, there are bones are not yet bones, but rather is cartilage. So it can have effect on such skeletal of the baby. That's my
thank you. Oh, the lady who first talked to us. Thank you very much. The first person who talked to us. So it's true. So doxycycline is contraindicated in pregnancy. with the fact that it can affect what? The tooth and what? The bone development what? In the fetus. This is contraindicated. So we are what? We are we should know what? The drugs that are contraindicated. So with pregnant women should not take what? The dozy, the prophylactic, and the what? The prophylactic. The azithromycin is considered to be both what? Safe and what? Effective. Amoxicillin is also what? Both safe and what? Effective. So we can opt for those drugs. Hello? Hello, can you all hear me?
Yes.
In fact, the network
Yes,
is it's not helping today. It's very, very bad. So after the complications, we are going to end the class so that you study for the midterm. Okay?
Thank you.
Thank you, sister.
Thank you.
God bless you.
Yes, sister.
Sister, you give that to twins, okay?
So after the
Please, we want it.
so after the complication, we all have to exit. Then at least you read for your midterm. What do we say about PID? Before we move on to the complications.
Sister, please, question again.
Just last week, we talked about PID. I'm asking like the complications in what? Women. The first one is PID. And I'm asking, what is PID? Or we did talk about that last week, just last week.
STI'S pelvic inflammatory disease.
Just last week or PID. And so what is that?
Sister, please, is the infection of the female reproductive organs. That's the uterus, the ovaries, the cervix, and the fallopian tubes.
So it means all infections at the pelvic region or the female reproductive system. Any infection is what part of what? PID. So the second one, cervicitis, salpingitis, they are all under what? PID. And it can lead to what? Ectopic pregnancy. When there's an infection, we know ectopic can cause what? Scarring and what others. And we know even salpingitis can result into what? Infertility. All infections in the female reproductive organ can, one way or the other, result what? Infertility. So these are what? And in men, we have what? The urethritis, because and what? Infection is caused by a bacteria. So urethritis, that's the urethra, that is the tube which carries what? Urine from the bladder to the end of what? The penis, when it becomes what? Inflamed. We have the epididymis, the rectal syndrome, that's both in men and what? Women. And these are chronic type of what? Inflammatory arthritis. That is when it spreads to other organs. It is known as what? The rectal syndrome. So with the rectal syndrome, it can affect both what? Men and what? Women. And in babies, we have what? The eye infections and what? The pneumonia. So prevention of what? How would chlamydia be prevented? It is all through what? Mass education. That is creating what? An awareness on the causes and what? Effects, the complications of what? STI. And possibly educating the public on the ABC method. That is the abstinence, be faithful to your partner, and what? Condom use. And also be in a long-term monogamous relationship. That is what stands for the B. be faithful to what? Your partner. And the C or to use listed as the condom what use. And regular what? Screening for what? Chlamydia. Apart from mass education, I don't think there will be anything that we can use to prevent what? STIs. So we will end the class, okay? And continue next week. So please use the extra time to revise for the upcoming what? Medicine.
Thank you, sister.
Areas.
Areas.
Please, we are kids. We don't know what we are doing. We want areas.
Oh,
Areas.
Don't get scared, okay?
Play sisters, adult learners. We are adult learners.
Yes, I understand. Okay. I understand adult education, okay. So either you can read on the malformations, okay?
PM and close at what time?
Yeah, it's starting on 7 p.m. to 7 p.m.
The following
And it's
day.
24 hours.
Almost
Yeah.
a TV, network, no more, and TV. Hey.
The network is very, very
Camera,
bad.
thank you, baby. There is a sister upon.
Sister, you are too much. Please, one person should talk.
Please read on the malformations, okay? Yeah.
Malformations. Thank you.
Yeah, the uterine malformations, and it's 40 marks and 40 minutes.
Wow.
You're going to answer 40 questions, and it's for 40 minutes. So one question is for 1 minute.
Sister, you are superb.
So all the
Sister,
best,
you
okay?
are too much. God bless you.
We love you, Mama Iba. We love you.
So all the best, okay? All right.
Thank you, sister. God bless you.
God willing, next week.
Thank you. The duration. Sister, please, the duration. How long will it be open?
7 p.m. to 7 p.m. Please go and revise for that, okay?
Yes,
sister.
Okay.
Uncle for love. Class P, yo.
Hey, why?
Class P, yo.
Wale people.